So tibial tuberosity fractures are a fracture which are more commonly happening in pediatric population of 8 to 12 years of age. What happens is that there are 5 different types of injuries which can happen as per Ogden. First is a fracture through the secondary epiphysis at the tibial tuberosity. Type 2 is the one which is nearly near the primary ossification center. Type 3 is the one extending through the near primary ossification center. Type 4 is involving entire proximal tibial physis. And type 5 is a periosteal avulsion. Prior to this flexion, it's important to note that most of the times there is a tibial periosteal sleeve avulsion as well, along with the type of injury which happens. I will assess the patient in A&E, check for neurovascular status, take the adequate history, apply a splint in position of comfort, admit the patient, exclude compartmental syndrome. There is a high predilection of anterior compartmental syndrome because the anterior tibial recurrent artery is close nearby. Regarding the fixation, I would prefer to do the 4 mm partially cannulated threaded screws along with repair for the periosteal sleeve as well.